दीदी दीदी,
क्या हुआ?
राम बहादुर को वहाँ बिजली का झटका लगा है और वो वहाँ गिरा पड़ा है। चलिए।
अच्छा चलो चलो
डॉक्टर को बुला के लाओ। पीछे तो हवा नहीं है,
घबराइए नहीं, देख लेते हैं। राम बहादुर, राम बहादुर, राम बहादुर, राम बहादुर, राम बहादुर, आंखें खोलो। Pulse is palpable.
और राम बहादुर ठीक हो गया, देखो अम्मा। अरे राम बहादुर ठीक हो गया, देखो
ठीक हो गया।
उसको सांस आने लग गई अम्मा। राम बहादुर ठीक हो गया अम्मा, तो ठीक हो गया, ये सांस आ रही है वापस अब धीरे धीरे इसकी है। हाँ पानी पिलाएंगे, अभी पिलाएंगे, रुको अभी रुको।
You must have come across a case of cardiac arrest during your work experience. Cardiac arrest, as you know, means sudden stoppage of pulse and respiration. This can occur in variety of situations like electric shock, suffocation, accidents, severe injuries and snake bite, etc. You need to act very fast within 4 to 6 minutes to save the life of a patient. In order to save the life of a patient, you have to provide basic life support by using technique of cardiopulmonary resuscitation. Cardiopulmonary resuscitation is a first aid technique of rescue breathing and chest compressions.
Begin the work immediately as every minute counts. Do not delay. Remove dentures, secretions and food particles. Place your ear above the casualty's mouth and look for chest and abdomen movement. Tilt the head backwards while supporting the back of the neck with your palm. This will lift the tongue to its normal position. This extends the head and the neck and opens the air passage. Once the airway is open, check for breathing again. Sometimes opening the airway will spontaneously start breathing. Always remember the ABC of resuscitation technique. A for airway, B for breathing and C for circulation. Open the airway. Remove debris. Lift the chin and tilt the head backward. Check for breathing by looking along the chest and abdomen for any movement. It is hygienic to cover the mouth of the casualty with a handkerchief or some clean cloth. Pinch the nostrils. Take a deep breath and blow air from your mouth into the casualty's mouth. While pinching nostrils, take care to see that you create a tight seal around the casualty's mouth with your lips to prevent any air leakage. Withdraw the mouth and observe if the chest falls back. Repeat this process 3 to 4 times. If the casualty's breathing has not been restored yet, continue mouth-to-mouth ventilation process until the casualty starts breathing. In the breathing technique, blow air from your mouth after pinching the nostril. Blow air mouth to mouth by creating a tight seal to prevent leakage. Watch the chest for expansion as you blow. If the heart is not working, the face is blue or pale, pupils are fixed and dilated, heartbeats and pulse at root of neck are not felt. In such a situation, it is time to use external chest compression. In this technique, place the heel of one hand on the lower and left angle of sternum and apply a little pressure on it.
1, 2, 3.
It is possible that even external chest compression does not work. Then, apply it along with mouth-to-mouth ventilation. When these two are done simultaneously, then the process is known as cardiopulmonary resuscitation or CPR. When two rescuers are available, the compression to breath ratio is 5:1. That is 5 compressions for every breath. When only one rescuer is available, the compression to breath ratio is 15:2. That is 15 compressions for every 2 breaths. The compression rate should be around 60 compressions per minute for adults and 80 to 100 compressions per minute for children. It is a must to follow certain points while performing CPR. Never compress the chest at the wrong position. Before compression, always be sure that the hand is kept at the correct position. Only the heel of your hand should touch the casualty's body, never the fingers. This would disseminate the force applied to a wider area, which is not effective. The wrist should always be perpendicular to the casualty's body. The elbows should be straight and locked. Do not bend the elbows. The shoulders should be straight in line with the casualty's sternum. During compression, utilize your body weight to give the needed force for compression. The sternum should be depressed at least 1.5 inches. This is the minimum limit. Do not interrupt CPR for more than 5 seconds for any reason. Be sure that you do not give any jerk or sudden movement while compressing the chest. When 2 rescuers are available, the compression to breath ratio is 5:1. That is 5 compressions for every breath. When only 1 rescuer is available, the compression to breath ratio is 15:2. That is 15 compressions for every 2 breaths. The compression rate should be around 60 compressions per minute for adults and 80 to 100 compressions per minute for children. Indications of a successful CPR are as follows. Chest expansion of the casualty with each breath. Each time the sternum is compressed, the pulse will be perceptible. Movement of the pupils in the eye. Spontaneous breathing of the casualty. Movement in the arms and the legs and improvement in the color of the skin and nails. When the casualty comes to the normal state, make him lie on the stretcher or a bed in recovery position and rush him to a nearby hospital.
You have seen how the health worker could save the life of Ram Bahadur by using effective cardiopulmonary resuscitation technique. You should act very fast because you know that brain cells can die within 4 to 6 minutes of cardiac arrest, and also the patient can die within 10 minutes. Not only you as a health worker, but also all the community members should know how to use this technique of cardiopulmonary resuscitation so that life of many people can be saved in the community.